into the issues. You mentioned healthcare, and then I'm going to go to Andrea for an environmental question. But on healthcare, since that was your topic going into this thing, you said early on, keep the things that are working. What do you see that is working in our healthcare system, Dr. Cameron Webb?
Well, I have to speak on behalf of my colleagues. I think we have an incredible healthcare workforce. We have incredible technologies. We have a system that literally, you can get a cure, you can get the best treatment in the world to so many conditions here in the United States. The challenge is that not everybody can get access to those things. And so the way for us to make sure that people can get access to the care that they need, that's the conversation we need to be having, is how to get that access to as many folks as possible. I mean, the reality is that people's health outcomes are so dictated by often where they live and how much they have. And so at a fundamental level, if we want to have a thriving society, we need to have thriving access to education and thriving access to healthcare. We know that to be true. And so yeah, I think where I start is I want everybody to have access to the care that they need. And I also want everybody so that's one of the key values, but I also want people to be able to choose where they get their care and how they get their care. And I think that's another key value. And threading that needle, I think, is where we need to be at this moment.
Okay, Andrea, I'm going to jump over to Brian. He has a question on COVID, and then we'll go back to Andrea. I'm going to keep them consistent here in topics.
Well, I honestly, I think the one big question that I have, and this is a generic question that I've been asking everybody that's campaigning right now, with COVID-19 and the way that has changed how we do business with each other. I mean, normally we wouldn't be on a show like this. We'd be talking to you in person or something like that. How has that impacted your campaigning? How are you reaching out to voters now? How do you get your message across when you can't go out and do stuff like go knock on their door and go talk to them?
Yeah, I mean, we've got to do this real 21st century campaigning. So for us, it's using spaces like this, leaning into Facebook. I have a weekly Facebook Live event that's a COVID update that in no way is partisan. And then the whole nature of it is just getting real factual information out to people. We have thousands of folks who watch this every single Monday night at 7 p.m. And so, yes, reaching folks on the various platforms, Facebook, Instagram, Twitter, YouTube, that's a start. But I think really it's just being creative about the way that we connect person to person. For us, reaching out to a range of different groups of individuals, certainly trying to find teachers, law enforcement officials, just really connecting with people exactly where they are and starting to have those conversations. And it was one thing in a primary, right? There are Democratic committees all over the district. I think it's a different thing now when we're getting into this conversation of there's a large number of either independent or undifferentiated individuals. There are a lot of conservatives here in the district who we want to make sure we're having that conversation with so they know who I am, what I'm about, and how I would aim to represent this district. And so that's the work that we're doing. It's just working hard to find people, meet them where they are. I expect that, the way that COVID is looking these days, we'll be doing this through the fall. We'll be having these conversations in virtual spaces. So we've gotten pretty good at it over the last few months. Expect to keep hanging. Okay,
Andrea, you have a question on the environment.
Well, I have a piggyback off of on the COVID very quickly. I have a friend of mine, this virologist, told me at the beginning of this that if we didn't handle correctly, that going into the next, which would be this current flu season, that one protein changes with a regular flu and you end up with an R naught of 4. And the average person doesn't understand what that means. How do you think the best way is to get politics out of COVID so that so that the scientists and the medical end of it can actually start,
doing the work?
Yeah.
You're absolutely right. I mean, I think that some of it is just we have to depoliticize it. I mean, every aspect of this virus has been politicized. And so I think now that we're seeing a surge in cases, it's not about who's right. It's not about who's wrong. It's about how we can get past this virus to get our economy rolling again. And we know that the best way to do that is to stop the new transmission of virus. I love the fact that you raised the flu season because I was just on a call with a bunch of school board members all across the district have been reaching out to me and they're like, so what should we be doing? Want to get our kids in school. I want to get my kids back in school. Trust me. And so it's how do we You've got to stick to the basics we've been talking about for a long time, which is prevent transmission of this virus. Absolutely, wear a mask in public spaces. If you're feeling sick, stay home, make sure that you're washing your hands regularly. Those basics of preventing transmission, there's nothing political about that. That's just normal good science. And Andrea, to your question about things changing, we've been chasing H1N1 or the different types of flu, those different proteins. Every year we give our best guess on how it's going to change. And then we have a vaccine that's usually less than 50% effective because we're guessing. COVID is mutating. It's changing. That spike protein that we're going to be using to develop a vaccine, that's changing too. And right now we know that it's changing in a way where it's still hopefully going to be effective, whatever virus, whether it's Moderna or the UK vaccine that they're creating, whatever vaccine we create is still going to be effective. But regardless, we've got to get our stuff in order, right? And so, I was out in my family and I went to the Great Smoky Mountains just the other week. I was out near Gatlinburg, over by Pigeon Forge, and there were literally thousands of people out there, not a mask to be seen. We got back home, and suddenly that's a hot spot for COVID, right? And I think the reality is just we are chasing our tails because we keep seeing these cases go up. Let's just all, in solidarity, say, let's get ahead of this so we can get back to business as usual. We just need to make that collective statement. I'd love for that to come from the top.
And staying on healthcare, we're going to go to Chris and then DJ. There we go.
Thank you. I didn't want y'all to have to hear my dogs, but then eventually it just turned into me. So Andrea sort of covered the first part of what I was going to ask about depoliticizing this, but then sort of as you're talking about that this is going to be with us for a while, how do we make sure that kids have what they need for computers, internet access, adults to oversee if we're going to be stuck in this distance learning situation, and do these changes actually offer us a way to look at an opportunity to look at education differently than we have in the past?
I mean, you answered the question right then and there. That's what we need to be doing. That idea of broadband access is critical infrastructure. In Madison County and Buckingham County, right near me, kids have been going to McDonald's for years just to have Wi-Fi access, right? The reality is it's just highlighting the fact, and this isn't partisan. Everybody believes that all of our kids should have access to broadband. Everybody believes that we should be closing that digital divide because it's so important for everybody to have access to the economy of today, not just the economy of the future. And so, yes, you're absolutely right. We have to focus on building that infrastructure. If this speeds us to doing that, that's good. Some of the counties, some of the more rural counties have been talking about putting in these kind of, these essentially towers for Wi-Fi access that are portable and using that. And we're going to try to amplify that by giving kids their own hotspots and some of the youth serving organizations that I've been working with and talking to. And these are all workarounds. The fact of the matter is we got to get broadband available and into every household to make that possible. And again, when we talk about the role of the market, everybody wants to have access to this. Everybody needs to have access to this. I'm in a district with 18,000 farmers, 11,000 farms, and yet there's still almost over a quarter of them who don't have Wi-Fi access. And so how can you be effective in your business if you're not even able to get in touch with folks using the internet? I think it's a powerful and important role, not just in education, but I think right now we're highlighting it in education in a major way. And you have to recognize this crisis. It's highlighting these issues, these inequities. And I think it's important for us to lean into and say, hey, let's fix this, because in rural communities, that's just how we make sure that every kid has a chance to succeed and live out the life of their dreams. That's that American dream. So, yeah.
DJ?
You mentioned one of the fundamental things about what you would like to see in healthcare is to make sure that consumers have the ability to choose where they go to get their care. How much do you think certificate of public need regimes like the one in Virginia and North Carolina get in the way of that? And what do you think the federal government could do to make them, to frankly make them more competitive and less restrictive?
Yeah, you saw my facial expression when you said certificates of need. That's one of those things that we've been battling against for a while. I think, there's what compels the notion of need in terms of healthcare is, the needs of the patients, the needs of people. And we're seeing that kind of blowing through that reality with COVID, all the bed shortages that we've had, and we're seeing that in so many places. You think you know what the need is, but just by limiting the growth of spaces, you're actually, cutting off your nose to spite your face. You're saying, hey, we're not the place that have the capacity to build and grow and have a healthcare system. They're not necessarily always having the opportunity to create that. I think that we do need to design our healthcare system in a way that looks at not just the entire Commonwealth, but also the entire country. There are a lot of rural counties that have hospitals that are closing, hospitals that aren't able to thrive, especially through this pandemic, especially when we don't have elective surgeries. So there's a lot about the dynamic in our healthcare system that we have to address to make sure that at most basic level, folks have access. That idea of need, though, that's played out in terms of CAT scanners and MRIs, and that's actually part of competitive advantage, right? That's part of places saying, hey, we have access to these technologies. And a quick story is I was in Spain with my family on a vacation last year. My sister-in-law got sick and spent a week in the hospital in Spain. And as a doctor, I knew she needed an MRI for this infection in her eye. I kept telling the doctors, I was like, she needs an MRI. And they were like, well, we don't have an MRI, so she's going to get a CAT scan. The thing that she needs. So she got multiple CAT scans, and then eventually she got an unnecessary surgery on her eye. And then they were like, oh, it wasn't a fluid collection, something an MRI would have easily told them, right? And so in this environment, when you're just limiting access to different technologies for whatever reason, again, you want to allow, if every facility has the potential to grow and to have the technologies that are top notch, that's us having a healthcare system that really serves everybody well. Now, the question and the challenge is, how does it add to the cost of care? There are a lot of things that add to the cost of care in our system, but yes, it can add to the cost of care. But that's where one thing that I say the Trump administration really got right on healthcare is the price transparency stuff. You see how dramatically different the prices are for an appendectomy from hospital to hospital, and you realize, wow, just the failure to actually share information about how much things cost is the reason we don't have real competition. So I think all of these things, none of them operate in isolation. You have to tie them all together and say, we can do much better.
Well, I think kudos to you for in an election season. Obviously, Donald Trump is not the top of the ticket for your party, but to tip the hat and be objective and give credit where credit is due is I think good on you. Good on you.